On day one, there were 2 people, and then 4, and then 16. In 3 months, it's 1 billion. That's where we're headed.
In the last act of the 2011 film Contagion, about a global pandemic, people are wearing barcoded wristbands proving they've been vaccinated against the deadly virus. Fiction might soon become reality. In November, the CEO of Qantas Airways said he likely would require travelers show proof of COVID-19 vaccination before boarding international flights. He said others in the airline industry will likely follow suit. Ticketmaster also indicated its clients might require proof of vaccination to attend music and sporting events in the future.
The need to authenticate one's vaccination status is likely to grow in importance. Companies like IBM and others are now competing to provide technological solutions that would allow for the digitalization of records and easy access to them.
IBM has created the Digital Health Pass, which it says will allow organizations to verify health credentials like COVID-19 test results and vaccine records through an encrypted digital wallet on a smartphone. This week, United Airlines launched a so-called Travel Ready Center, available through its app that allows passengers to upload testing or vaccination records. Digital privacy advocates are concerned, saying the technology sector is not as regulated as government-run health systems, and promises of privacy are never a guarantee.
You can use security measures, encryption measures, the best that you can possibly do, right? You can protect data at rest and data in transit. There are standard practices for that online. Whether or not that will protect you 100%, it's always going to be no, because anything online is at risk.
The European Union recently discussed the issue of digital vaccination passports. Greece and other nations that rely heavily on tourism are in favor of them. Other countries have expressed concerns over privacy and unequal access to vaccines. The fear is that vaccine passports would create a system of haves and have-nots. Another current challenge is coordination among all the different apps being created. A collective of more than 300 people from dozens of private and public sector entities on 5 continents called the COVID-19 Credentials Initiative has been formed to set universal standards.
I think the key to a successful rollout of any credential program, especially when we're talking about, in a public health scenario, is interoperability, right? It's building on open standards that doesn't create any vendor lock-in, that can provide the type of interoperability email has, right? As a Gmail user, I can send email to Outlook. It's the same idea.
The goal is to create a universally accepted verification marker like a QR code that could be easily transferred from one app to another. At the moment, we don't know whether the COVID-19 vaccines prevent someone from getting and transmitting the virus, but that could change. If vaccines are deemed capable of stopping the spread, vaccination passports are more likely to become a reality. Karina Huber, CGTN, New York.